Go ahead and set up your stuff. So right now, Mrs. Yushang said we're going to do 1 intradermal injection. So this is the supply I need. I'm going to grab my gloves. I'm going to grab my, I need the needle to draw the medication. I know the right needle. Remember, 1/2 inch and 25 gauge. I know the 1 cc syringe. I have my vial. I have some alcohol wipes. I have some gauze in case the patient needs to dab it. And then you never ever need bandages for intradermal. But since we're in the class, I always have it. And then I have my ruler for reading, and I have a pen for marking. Okay. All right, let's get started. She's gonna come and we'll do it. Okay, go ahead and so started first thing. Remember, you're gonna go patient rights. Every single time we do the patient rights. So this is the right patient, this is the right medication, this is the right date we're doing, and so on. All of the rights are done. Label check. We already had my provider order. So the provider said the TB skin test. I have it, and I have matched it with my provider order and my medication. My first one. My second one, I'm gonna go dry it. All right. My third one, I'm going to go to my patient room. I'm going to pull up the chart. I tried. My fourth one, when I'm documenting. All right. Okay. So this one, I'm going to go ahead and ask my patient to bring their arms out. Technically, by law, as soon as that they bring their arm out, this is a consent that you're allowed to touch them. But I always ask them, is it okay for me to touch you? Awesome. So I already introduced myself. I confirm my patient's identification, and my patient knows that they're coming here for a TB screening test. So go ahead and bring your arm out, please. So let's go ahead and go with your left one. Okay. So what I'm going to do is I'm going to look at your arm here, and I'm going to divide that in 3 parts. So if I look at her arm, this is like my first part. This is my second part, and this is my third part. So my focus is going to be on the middle part, right? So I'm going to just make sure that I stay around here. I'm going to observe the skin. I see like a little mole here, so I'm going to avoid that. I see there's a vein coming this way, a vein is coming this way, a vein is coming this way. So going to avoid that. There's no scarring, and there's no heat. There's no swelling or anything. So my goal is to go right here. Now that I know where I'm going, I'm going to grab my alcohol wipe. And my patient does not have any allergies, so I'm going to did you guys see how I just grabbed it from the side? I'm not grabbing because my gloves are not clean, right? Even though they're gloves. I grab it from the side and I put it right on my patient. And I'm going to hold it from the middle. And I'm just going to make a circular motion 2 inches away from the area you want to go. Okay? It never ever hurts. Can you see? It never ever hurts. You can grab a chair and come sit right here. Matt, can you get a chair? I'm going to show you one more time, okay? And that way you're not blocking them and you're able to see. So I'm going to go ahead and grab my alcohol wipe. I'm not touching it again. My gloves are not clean. So I'm just going to drop this right here where I want to go. Start from the circle. And I'm going to work my way out. And I'm not going to blow on this. I'm not going to fan it. I'm not going to do anything. I'm just going to let that dry. While that's drying, remember medication, the patients might not like to look at the needle. So I'm going to go ahead and get my medication ready at my medication room, especially if it's a multi-dose, because I don't want it to get contaminated. So I'm going to move this. I'm going to bring my plunger back, easing it up a few times. And then my provider says 0.1, so I'm going to put 0.1 air. And then I'm going to grab a new brand alcohol wipe. Gonna clean my vial, put my vial down, and then I'm gonna go ahead like a princess, open up my needle, turn it down, single hand, gonna go ahead and inject that air into the vial, and then you're gonna go ahead and inject that air into the vial, and I'm gonna pull my plunger back, making sure there's no bubbles. You see that I'm passing my limit right now, right? I'm at 0.3. I only want 0.1 because there's a bubble I have. My goal is to get rid of that bubble. So I'm putting a little bit more medication in here, and then I'm going to push this back in to meet to 0.1. I still have a bubble. I don't like it, so I'm going to pull my medication back a little bit more. See if I can get rid of that. Okay, here we go. And I'm going to go right at 0.1. Since I have a bubble, I did not stop at 0.1. I got a little bit more. I'm gonna put this down, gonna grab this, and from here, what do I do? Thank you. And Miss Jasmine is keeping an eye on me, so I'm not touching anything else. And I want to hear a click. And then when that click is done, then I'm gonna go ahead and make sure there's no bubble in here. Do you guys see that little tiny bubble? We're gonna get rid of that. Click it. And then we're going to push to make sure that we get to 0.1 exactly, because we don't want to overdose or underdose our patient. Now I'm ready. And since that time, she did not touch it, I did not touch it, I'm ready to go. I don't like doing this sitting down, but I sit because people behind me can see. So I'm going to do what I'm going to do is I'm going to hold my hand right here, and I'm going to anchor. This is anchoring, guys, okay? Anchoring from top. We don't want to anchor from the bottom, because what was the degree angle we want to go?
5 to 15.
5 to 15. So if I put my hand right here and I anchor means you're stretching the skin. Come around here. You cannot see anything. I can't see you. That means they can't see me. We're going to come around. If we go on the bottom part, I already added at least 20-degree angle right here. Right? So if we want to go superficial, if I have this, you still can't see, can you? You can? We anchoring it down. That's still giving me, look at that angle. What I want to do is I don't want my opposite hand to be on the way. So I'm going to anchor it from this side up. When I go to my patient's skin superficial, sometimes people's hands shake. If you get a habit of putting these 3 fingers on the side, that can give a control to your hand, especially with intradermal, because intradermal, just the tip of the needle goes inside the patient's skin, not a lot, okay? So my goal is going to be, I'm going to put 3 fingers right here, pulling your skin a little bit, which we call it anchoring. My bevel is going to be up. I'm going to insert right under your skin, and then I'm going to inject my medication. Once I inject the medication, it's going to look, your skin is going to give me a wheel, like a bubble, and that's totally normal. Okay? Here we go. All right.
You got this, babe.
So very, very tight, and take a deep breath in. And that's it. Okay? So from here, guys, you see how I let go of my other hand? Now the tip, only the teeny tiny tip of the needle was on. The goal is to inject your medication slowly. If you inject it too fast, that's going to go under the skin, and that's not going to give you the wheel. If you don't get that wheel, that's not a good thing. You want to make sure when you inject the medication, you get a wheel. Never ever I can tell you how slow or how fast you go until you get a habit of it. So when you inject your patient, you will understand, is this too fast or is this too slow? Okay? And I'm all done now. I'm going to go ahead and let go of it. Somebody tell me, what's the first thing I do when I take my needle out?
Safety.
What's the second thing?
Sharps.
Safety, sharps. Straight to that. Now from here on, if there's any leaking, we're just going to grab a gauze. No alcohol wipe, no bandages. Gently dab, dab, dab. Okay? So this is the post instruction to my patient. Please make sure that you're not rubbing any soap or lotion in this area. If you need to take a shower, just let the water go over it. And if there's itchiness, please do not stretch or itch it. Make sure you're not putting a band-aid on it. And if you want, you can take these home, and if there's any leaking, just dab on that. If you have any shortness of breath, chest pain, you need to call 911 right away. And if you have any other concerns, there's burning sensation around it, swollen, redness, you give us a call right away. And we understand that we're going to come back 48 to 72 hours, right? And here's your window. You cannot come sooner than this date and time, and you cannot come later than this and time. I'm going to keep you in the office to watch for at least 20 minutes. Are you able to sit down at the front office for 20 minutes? Perfect. Once that 20 minutes is up, I'm going to come check on you, and then we'll let you go. Is that okay? Perfect. So I'm going to go ahead and let my patient sit at the front office, check with someone. The 20 minutes is up. She's good. I'm going to document it, let her go. Today she's gone. Now we're going to do the reading. Okay, she's gone. She went home. Bye-bye. All right. 2 days later. This is 2 days later. Oh, hello. We're back. So the first thing we're going to do, when the patient is back for a reading is? Review the chart. So they said she's here for to have testing. Okay, I don't trust it, so I'm just going to go and review my chart. I reviewed my chart. I understand that she got her TB screening test on right forearm. I understood that she got it 2 days ago. We're going to go ahead and introduce ourselves. We tell them that we're going to read. But since I do a reading, so I'm going to go ahead and bring my pen and my ruler with me. All right, so we already introduced. We already confirmed. May I please see your arm? Perfect. Now, this process, what I'm going to do, I'm just going to look at your arm, and then I'm going to touch your arm, which is palpation. And then we're going to measure that, and then we'll let the provider know. Is that okay? Perfect. May I have, oh, that sounds so much quieter. Can I see your other arm, please? Perfect. And is it okay for me to touch you? Thank you. So comparing the arm, me, if she would have come back, I'm like, okay, there's a little bit redness in this area because I just injected this right away, right? Okay, so I see that there's red. This looks perfectly okay. Do you have any fever? Do you feel any itchies or anything? No. Okay, you can go ahead and put this one away. I'm just gonna gently going to go ahead and palpate here. Okay, she can feel it that I'm pushing down in here, so don't be shy to push it down. And I never look when I push down. Okay, so up and down, down to up. Okay, and then I'm gonna go right and left, and I feel that little lump the opposite way. Okay, so I felt a little bit bump right here, so I'm just gonna go ahead and measure that. Is it okay if I put some ink on you? Okay, so I'm gonna grab my pen. I'm gonna mark it as I'm coming up. The pen, that the special pen that it give you a resistancy. Okay, I have such a quiet patient. Okay, all right. All right, stops right here. Stop right here. Okay, so now what I'm gonna do, and each time you use this, please make sure you get an alcohol wipe and clean it, okay? I'm just gonna measure this from one arrow, 0 to my other arrow, and that's 5 mm. So what I'm gonna go ahead and gonna let the provider know, and we'll go from there, okay? So I'm gonna go. Her patient was here for a TB screening reading. Chart was reviewed, arm was inspected, palpated, measured at 5 mm. Patient had no further question, provider was notified. Okay, and that's it. How was it?
You were so brave.